This particular chapter is very important because you will deal with this most of the time in the hospital. This is the process of homeostasis, and one of the things that you always do is what? Phlebotomy, putting injection, cleaning wounds over there, meaning that this particular chapter is something that will be hunting you out later on in your career. That's why we need to understand what's going on over here, how that blood coagulates, and all the process that happens over there. Obviously, I cannot ask you everything over here, but I need to go with some particular specific that will show up in your quiz next week. The first thing that you see over here is a definition that is hemostasis. In the old days, I like to play without wording, but in not will be the case in this quiz. This will be in the midterm. Meaning in the midterm, I have something very interesting with you because you see over here that you have hemostasis, you have homeostasis, and you have a huge amount of definition that you will see later that start with H. And preparation H also is part of that particular wording. Meaning, careful with this in the midterm because I have a multiple choice where I will put those particular definitions, I will mix them all, and you need to pull out the right terminology over there. But right now, in this particular one, I don't have a question just for the midterm later on in the role. Let's move on. We have some stage of hemostasis. Hemostasis, primary hemostasis is basically the initial response when you have an injury of any kind involving the interaction between the platelets and the endothelium. Something that I need to explain before we continue with this definition. Yeah, I will do some kind of Da Vinci work over here. I hope that you forgive me about how well I do my drawing as over here. The size of a blood vessels, all this length, all this wideness that the blood vessel possess, there is a huge group of cells over here. But the layer of cells that are in basically in direct contact with the blood that is passing through, that layer, basically the internal surface over there that I will do lines over here, is what we call endothelium. Endothelium have an interesting properties because keep the blood flowing. It's very viscous. It's like touch a surface that has some kind of soap and your beautiful hand basically pass on over there. And that is basically the main purpose of the endothelium. Keep the blood flowing in a beautiful way to avoid that this blood became basically coagulated, basically became stuck in one area of the vascular system. The problem is that that particular endothelium, yeah, I will do part of the drawing again over here. Sometimes under blood pressure, high blood pressure can damage that inner surface over there. And that is a problem because as soon you have an injury, exactly what you see over here, immediately all this primary system start to show up in that location to start the repairs of that place. The problem with that repair is that sometimes the repair became a little bit out of shape, out of tweak, and many things could happen when we try to repair something of that kind of damage. That is basically is a tiny preview. When we enter to that particular session, I will explain a little more. Now, again, I will not ask you anything about the primary right now. And you have the secondary hemostasis that I will not ask you this one now. You see over here that you have primary and secondary, and this one basically involving the formations of that clot. That is basically the difference between primary and secondary. Obviously, nothing of this will happen unless that we have these fellows, the famous platelets. Remember that you need to remember the range of the platelets always, because I have a question. We saw that one last night. Yeah, I want to make sure that everybody remembers, especially the people that didn't show up last night that are today, that you need to review those range of white blood cells, red blood cells, exactly. Remember that in the case of the platelets over here, this fellows goes 140, 50 to almost 600,000 something over here. Anything between that range, exactly. Over here, let me delete this one over here to be more specific because that depends the lab. But normally it goes like that. Anything that goes beneath of that number is a person that probably can breathe out himself. And that is the reason that we need to pay attention also to the big numbers, because anything that is bigger or the other range can create coagulation and can create another set of problems. Meaning that always we need to look in that range for any particular situation that can arise in that patient. Obviously, the clinical history will tell if that person is under some kind of medication like anticoagulant because he's a person that have a cardiovascular problem. But this is something that you need to know ahead, meaning we need to read the reports, we need to read the clinical history of the patient, and even if you are not sure, the duty of the nurse is to ask to the patient, hey, do you are taking any particular prescription? Most of the time when I'm working in the hospital, the nurse don't care. They think that that is something that the doctor or somebody else need to do. No, you are the person that is putting that prescription. I just put the order over there. And this is the reason why sometimes something arises because the nurse assume many things that are not in the medical record. And believe me, if this is not a medical record, no matter what the doctor said to you in the hallway, it's a lie. Meaning, if there is not any paper that the doctor put over there, this is the prescription that you need to put, nobody can cover your back. Okay, let me leave over here. But again, as you see over here, platelets always will reach to the areas of the injury and immediately start to patch that area of the injury because the endothelium, once that is damaged, will expose those collagen that are the inner part of the endothelium, and it's basically like a beautiful 911 call for these particular cells. The problem with this is that once the platelets over there adhere to that place, start to release another kinds of chemical to attract another white blood cells and at the same time to try to initiate the repair of that damaged area. That is a problem if you have a tiny vessel. Why? Because huge amounts of cells that trying to reach to that area and it's a tiny vessel, for example, could be the heart, could be the brain, you can have an area that probably can develop ischemia because the amounts of presence of cells in that area that will not allow the passage of blood. But again, this is just an explanation. I will not ask you this one now. We have another set of granules over there. I will not ask you this one because this is more hematology. Alpha granules and dense bodies release clotting factors that induce the cold or more platelets over here. Again, involved in the hemostasis and the clot retraction because I don't have time to ask for these ones in the quiz. That is the reason that I put this one out. All right. Remember, if you have any kind of question, just put it over there in the chat and we will go through there. Now, this is the first thing that you need to know for your quiz. This is a multiple choice. All the clotting factors are synthesized by your liver. Why then, when you have a person that has some kind of liver problem, all these particular person have a problem in coagulation? Obviously, it's because the liver who is the one who produces the coagulation factors. Immediately you can assume that a person that is an alcoholic is the patient number one that have a problem in the coagulation factors. It's very simple. Could be a person that also will have problem with the vitamin D production because the liver is the second organ in the process of vitamin D. Meaning that in that particular view, you see that the liver play an important role in many things. That is the reason that this is a multiple choice. It's just one question in one quiz. The next one, also very important. I will ask this one in several ways. This is multiple choice. This is true or false. This is, I will say, different kinds of questions related to the multiple choice. I can tell you right now that everybody will see a question related to this particular PowerPoint. The blood coagulation factors, you have factor 2, factor 7, factor 9, factor 10. I will tell you from now, I like to put Roman numbers like crazy over there, meaning you need to be extremely careful that that is the right Roman number. Because, I became a little bit nasty. I put triple X, I can put MCY, meaning that I will put a bunch of letters over there to just try to trick you out. Important also to pay attention that most of these factors that you see over here are dependent on the vitamin K synthesis. If you don't have vitamin K, we have a problem in coagulation over there too, meaning that this is the reason that this factor is really dependent for vitamin K. One question to the audience. I want to know where I can obtain vitamin K. And please, no spinach. Somebody can tell me that. From where we can obtain vitamin K. Ta-na-na-na-na. The bananas. Good for you, Anthony. Kidney. Oh my God, Macias. Of course not. Fish. Of course not. Front liver, kale, bone marrow. Uh-huh. Oh, green veggies. Interesting, Ron. Dietary supplement, obviously, Jennifer, we obtain supplements with everything over there. But normally, and this will be a shock for some of you, the spleen, of course not. Um, believe it or not, my dears, your beautiful bacteria that are in your intestine are the one who do that favor for you. Meaning that many people completely forget that you have a beautiful family of bacteria living inside of your gut that in exchange for the food that you are eating, they will produce a set of vitamins in exchange for the food that you are digging in. And vitamin K is one of these particular vitamins that bacteria that are in your intestine produce for you. And not only that, also some of the complex B could be over there. That is correct. That is the reason why we need to be extremely careful with a huge prolonged antibiotic therapy, because these bacteria also suffer when they are exposed to the huge amounts of antibiotic for too long. Again, careful with those three bullets. Everybody will see, a true or false, or a multiple choice of this particular slide. I basically split this particular slide in several ways. A true or false from this one, a true or false from this one, a true or false for this one, and some of them multiple choice, meaning that I basically playing with this slide to make sure that the four tests will have a question from here, not necessarily the same question, but some topic from here. The next one, the fibrin clot, very important in this because you have an intrinsic pathway. Somebody of you will have a true or false, and somebody of you will have a multiple choice, meaning careful with this one. Somebody will see the first one, 2 for 2. The other two will see the next one below. Could be a multiple choice, could be a true or false. Indeed. The next one, fibrin clot, intrinsic and extrinsic pathway lead to the common final pathway. I need to tell you that in every particular process of hemostasis, calcium is essential. If you don't have calcium, you motions of these coagulation factors either. Meaning that even here, calcium play an important role in the moment that the blood start to coagulate. Okay. But again, I will not ask you this one right now. We had the famous fibrinolysis that is exactly important like the formations of the clot, because you cannot leave a clot hanging over there inside of your vessel forever. Obviously, you need to have a clot dissolution. Happens as the fibrin clot is forming, and you have these particular factors. Okay? Because sometimes I'm with the factors that are dependent from vitamin K, and many people hate me for because of that. But hey, I need to do it to make sure that you understand these particular factors. These fellows prevent thrombosis. That is correct. But sadly for us, not all the time are so good in doing what they are doing because they can go to the extreme in some scenarios. We will discuss that one later. But again, careful with this particular process over here, especially when you have kallikrein, it sound very familiar to erythropoietin and others like that, that will end in that in that many people, they already start to suffer. For example, you have thrombin and plasmin in that particular area also, meaning that it's a multiple choice for some and a true or false for others. I will say that we will see this question in 2 or 4 in different kinds of variants, meaning that one test will have the multiple choice, the other test the true or false. Moving on over there. This one I decided to remove it away. It's very similar to the previous one, meaning that I will jump it immediately. And then we have the evaluations of hemostasis and coagulation. Remember, for us in medicine, and this is the reason why I put you to do the discussions of the video in that particular way, because that is the first thing that you need to know, how to subtract the clinical history of the patient. 99% of the time, the patient will tell you word by word what is suffering. But if we don't pay attention to make assumptions about what is going on, we'll mess up over there. Meaning, patient history, very important. Then follow the physical examinations and the clinical assessment. This is why I stress myself that when you see a video, the person was diagnosed with this disease. Wow, how we reach to that disease if we never saw the patient history and never described the patient history first? The sex, the year, the age, so on, so on, so on, until we can reach that conclusions of that diagnosis. Okay, but again, I will not ask you this. Moving on to the next one. These particular areas is to identify some particular pathologies that are related exactly with bleeding. I don't ask you this one because I want to go directly to the hemophilias, and that is the reason that I will not go with this. I need to tell you, a person that have a problem in the coagulation factor, because a liver problem or because genetics is a huge problem to keep them in surgery because he can bleed out himself just with touch them, meaning that we need to be also stressing that clinical history. But again, I don't have a question from this slide. The same thing over here, clinical assessment, personal family history of the bleeding disorders. We will see many things. Many people have a problem with aspirin because they take a lot of aspirin. That is the reason that in recent, I would say, years, we start to advise to most of the people that are taking aspirin as a prevention not to use them. I don't like that advice because we are telling to the patient for so many egos that the aspirin can help you out to so many things, that the baby aspirin can help you out, but the data information is showing that many people are taking now aspirin like some kind of candy or chocolate, and that is a huge problem because then you have the famous ulcers that start to show up and also internal bleeding because of that. That's why now there is a reasoning to avoid that the patient start to take aspirin in the daily life in the week. I still, if it's me as a doctor, I still recommend an aspirin 88, but not necessarily need to be every day. For me, if you take an aspirin 3 times a week, we are fine. But the problem is, like human that we are, they think that most or much medication better for you. Obviously, better for you if you want to stop living. Meaning that we need to address that with the patient when we have them in front of them. Again, I will not ask you this one. Now, the clinical assessment, obviously, this is the kinds of thing that you need to pay attention when you have a person that probably have a problem with the bleeding. I will not ask you this one because I have something similar sooner. But remember, a person that is losing a lot of blood, that is the first indication that is losing a lot of blood because will be pale. Jaundice, you already know there is an obstruction over there in the liver or in the biliary tree that making the bile retrograde inside of the bloodstream, and that bile start to accumulate, or the bilirubin start to accumulate in the tissues. And something like that, hemarthrosis, another set of problem with blood in the liver, petechias, this particular one, something that we need to check in the skin of the patient when we have this particular problem with the coagulation factors. But right now, no, I will not ask you that. These particular definitions is important for us because this is what we use in the medical record. I know there is a pain for some of you because you try to say, the person is bleeding through the nose. No, 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 no. In medicine and in a hospital, this is the terminology that you're supposed to be using. You cannot put over there, I have a full of full of blood. No. Hematochezia or melena. I have a lot of blood with urine. No. Hematuria. Meaning that you need to start to address this particular terminology when you enter in the hospital. But again, I will not ask you for this. Now, the evaluations to the primary and secondary disorders, obviously, the CBC is the cardinal point over here. But again, I am not asking you anything about this particular one because the big questions are almost at the end of the chapter, meaning that I will not go with this one either. See, I am coding, coding, coding. None, nothing, nothing, just basically two of them in the beginning, okay? Now, in this one, there is a multiple choice related with this bullet, meaning there is two questions, multiple choice, both of them, and related the famous PT and I and R. Very important because that will tell me how those coagulation factors are working over here. These particular scenarios is basically important for the person that is cardiac patient and is taking anticoagulants. We need to monitor that INR constantly to make sure that the anticoagulant don't go beyond what it's supposed to be doing. Even so, a person that is taking anticoagulant for so long, you can check their skins. You will see a lot of hematomas or petechias because it's the blood basically escaping through the skin over there, or the vessel to the skin. Again, careful with this one, multiple choice, 2 or 4 tests, that particular bullet. Forget about the question, I will go over there later, and then we enter to the vascular disorders, and it's here that you have most of the questions related to this chapter. Again, I will not go with this one. This one is a multiple choice, and you will see this one, I think, in 3 tests of 4, multiple choice. This is a vascular purpura, a normality of the vessel or supporting tissue. You have the petechias are present. That is the tiny, tiny, tiny one, I would say, point of blood that you will see in the skin sometimes is the way how I can basically describe them. Allergic purpura, because sometimes there is autoimmune process involved over here. The immune system basically broken those particular red blood cells and also the vessels. And there is a beautiful syndrome that basically is related with this particular situation. The collagen in those vessels is very deficient, and that's why the blood starts to escape out from those particular vessels. Meaning this is a multiple choice, 3 or 4 tests, they will see this particular multiple choice. Moving on to the next one. This one, I pull out this particular line over here to add it to the previous one in the multiple choice. Remember, careful with vitamin C, very important when you have this particular problem with the collagen. I have to remove this one out, but the first bullet, this one in particular, vitamin C, is included with the previous one to do the multiple choice. Moving on to the next one. The vascular purpura, location, depend the agent, the diagnosis, all these particular tests, I avoid them to you right now. I will not go with this one. Now, I have a question with this one. Is a true or false? Just in one test of 4. It's interesting because we have several situations that when you have a person with bleeding problems, it's related problems in the genome over there. Meaning that that is the reason why I am putting out some of the diseases because even that we don't see it now and then, because the majority of the person that have bleeding problem is related to non-narcotics medication related to cardiac problem. You never know when you have a person that probably is an hemophilic, and we need to go and make sure to do the rule out of the problem pathology. Meaning, careful with this one. Again, a true or false in one of four tests over there. This one over here is part of the previous one too, meaning that I subtract some over here, especially the first bullet, meaning that careful with this one because it's part of the previous one. I didn't go to the treatment because in this treatment, as you see over there, is supportive and it's nothing to cure this particular condition. Then we enter to the platelet disorders. Obviously, primary cause of bleeding is the abnormality in the quantity or the quality of those platelets. This is a very important line, even that I don't ask you this one. I need to tell you that this is a question in midterm. Meaning the midterm, you will see it over there. Moving to the next one. Thrombocytopenia, immune thrombocytopenia is one that is acquired, immune-mediated disorders. You will see that you have persistent or chronic. I will not go with this one. It's something that you will see in some patients, but normally not all of them, meaning that I will not ask you this one right now in your quiz. The general mechanism over there of thrombocytopenia, obviously decrease in the productions of the platelets over there, or the survival frame of these particular platelets become very small. Splenic sequestration, that is something that we need to always observe in the patient. If for some reason you have some kind of anemia that you cannot explain, we always need to check the spleen because sometimes the spleen is overworking. Remember that the spleen is the reservoir of blood, but at the same time, it's always checking the conditions of the red blood cells. Once that the red blood cell pass the famous 120 days, of that beautiful lifetime, the spleen basically will try to remove those fellows that are a little bit older and to reuse all the different elements that we have inside of the red blood cells. Hemoglobin, biliverdin, and most of things that basically are inside of these particular red blood cells, even some vitamins too. But sometimes the spleen overwork too much and start to destroy in excess normal red blood cells that can still doing their job. And in that kind of a scenario, you can have an splenomegalia. And when we observe that, the indication over here is to remove the spleen. Again, I will not ask you this, just to explain something there. Thrombocytopenia, common causes, bone marrow suppression from chemotherapy, recent immunization, and cold injection, obviously. Obviously, you will see the low platelet count, petechia purpura. I will not go with this one right now. The your quiz is out. But this one is important for me. You see over there the range. Beyond of that is thrombocytosis. Careful with this particular PowerPoint. Primary polycythemia vera last night. Careful with this one because it's very related to thrombocytosis. Huge amounts of red blood cells can basically trigger coagulations of the blood over there, and that is a huge issue for the vascular system. The secondary response to the hemorrhage, disease, or process of the famous splenectomy that I basically mentioned before. There is one question related to this PowerPoint, and it's a true or false. Moving on to the next one. Thrombocytosis may bleed or clot. Treatment reserved for primary etiologies. I will not go with this either. I will help you out with this particular one. The question, you have it over there. I leave that one to you. And then we have some particular disorders that are basically in your medical books. You have the famous Bernard-Soiler syndrome or von Willebrand disease. This one in particular, you already know that I will ask for this one because it's very, very frequent that we will see this one in some particular patients that are hemophilic or with some alterations in those clotting disorders. From this particular himself, I will not ask you anything. Yes, that is correct, but not from this one. Uh, Others, qualitative platelet disorders, this one is a multiple choice, one of four, multiple choice. You will see many disorders in this area. It's important to make sure that you have in that CBC the differential. How many of the red blood cells, how many of the white blood cells, or the neutrophils, or the lymphocytes, or the platelets, because that is the indication, the first initiation that we can guide this patient to the right track. Most of the time when we have a patient like these ones, is after a couple of weeks that some people notice there is something wrong with the levels of platelets or with the coagulation factors. That's why we always need to pay attention in the examination in the clinical history. Again, careful with this one, multiple choice. The famous coagulopathies are defects of the normal clotting mechanism, and we are entering over there soon to the hemophilias, but I will not go with this one. There you go. This is a multiple choice. Every test will see this particular question. I will play with this one. And the reason that I need to make sure the majority of you go through this one is because it's one of the most common inherited coagulation disorders. You have hemophilia A, hemophilia B. You need to be extreme and pay attention that because I like to tweak the hemophilia with the definitions over here. But almost everybody will see this question. Okay, it's a multiple choice for almost everybody over here. Also, I like to use the treatment in this case. Careful, I included in the multiple choice of some of the tests. In others, you don't see it, but it's important that in this particular patients, when you have an emergency, this is the treatment of choice. In some hemophilia A patients, we can basically have an IV fluid just for the factor that they need because we already have that technology to separate every component of the blood, exactly what I said in class, and we can do particular solution just with the factor that is needed. Yes, correct, included in the previous one. Then you have the famous von Willebrand disease. This is the one that I mentioned also that is very related to a true or false that I have over there, true or false. I think two tests will see this true or false. Careful with this one. It's very similar to the previous one, but it's the same particular information. Yes, that is correct. Emergency treatment. And the reason for that is if you already know, the patient is already known by you, we already can identify what is the coagulation factor that is missing. Once that we have that information with a particular company that they only do the separations of every components in the plasma and they can prepare, believe it or not, bags of these coagulation factors in plasma. Obviously, is it something that is against time and we don't have any other option or call the company on time to be produced with these particular things? We go with a fresh frozen plasma where you will have all the coagulation factor no matter what. Meaning there is an emergency treatment over there because if we don't have the access to have the what exactly what we need, we go with all the power with everything that we have in our hands. Okay, those depend the hospital that you are. Okay, moving on to the next one. Again, this is part of the previous one too. The treatment I like to use it over there. Desmopressin, which release von Willebrand factor and factor 8 from the vascular endothelial cells. Cryoprecipitate, use it to manage severe bleeding. That's why this person avoid aspirin because obviously aspirin is a blood thinner. Meaning careful with this one is part of the previous one in the multiple choice. Moving on. Again, I already made the previous question regarding what are the factors depending on vitamin K. This is like a repetition over there. Make sure that you review them because that question is there. I did it over there. I like to tweak the different factors to see you can catch one that don't belong over there. I will not go with this yet. I need to explain something later, but this is basically a repetition. I will not go with this one in particular. Now, vitamin K deficiency bleeding in the infancy, normally, believe it or not, in some particular hospital, they still doing this, is that we give a tiny shot of vitamin K to the newborn to make sure that in case that show up with some particular coagulation disorder, the baby don't bleed out. Obviously, they need to have a good clinical history for that kind of situation. Yes, 41 is out. And this one too. Vitamin acquired deficiency, vitamin K deficiency, obviously. Remember that this vitamin is fat soluble vitamin. Nothing. It's because it's very similar to the previous one. May occur with a malnutrition, malabsorption, chronic hepatic disease. And this is interesting because the person that was listening to me last night and regarding vitamin B, especially the B12, vitamin B12 is a vitamin that helps you out to absorb fat. Is you don't have vitamin B12, you cannot absorb fat, and any vitamin that you need that is basically fat soluble, you cannot absorb it either. Meaning that indirectly, an affection in vitamin B12 can also affect the absorptions of other vitamins over there. Again, I will not ask you this one in particular. It's very related to the other one that we saw already. Now, the acquired vitamin K deficiency, this is basically the same repetition. The PT and R increase, but other coagulation studies normal. While the treatment, you see that it's bleeding out and give vitamin KO immediately. This is something that could happen in cardiac patients, especially when they are taking a lot of coumarin. That is the beautiful anticoagulant by excellence, one of the older ones. In these days, we don't have this one as a preference. We have others that are more powerful like this one, but there is still some doctors that like to use this one, Coumadin. The problem is when the old people start to take more than the doses that is supposed to be taken, they rush to the hospital with those abnormal bleeding, and this is what you need to do immediately, an administration of vitamin K or a beautiful shot with vitamin K. But again, I will not ask you this one. This one is very important. Yeah, I think I mentioned this one in one particular class, the famous disseminated intravascular coagulation. Very, very quickly, a person can die from this particular condition. Sadly for us, the majority of these particular cases is related to gynecology. One of the classes I make the story, the other two classes probably they don't know, but I confronted this situation. Thanks to God, the case basically don't come directly to me, but I assisted after the situation happens. And this is a situation where the mother can have a delivery of the baby in some particular hospital like mine in those days. We tend to clean the internal part of the uterus after the delivery, after the birth of the baby, until the placenta comes out. For us, that's important because you, with that tiny swab and very gentle swab, you will try to remove whatever debris of placenta or tissue that is still remain after the placenta expulsion. If you don't do that, the mother that is coming out from that delivery will continue bleeding for a couple of days and will take a longer for that bleed to stop. And the mother that probably that you have in the audience already have that experience, how much bleeding you have in the first 24 hours. But in our case, we always do that swab. We put our hands inside of you and clean the uterus from inside out very gently to remove the excess of tissue. The problem over here in that particular lady, that basically the doctor didn't perform that particular situation and let them bleed. The problem is she took an infection The infection at this level spread, and basically she died by this disease. Could happen, could happen with a C-section if in the moments of that delivery the gynecology don't clean that uterus completely. I like the C-section in that you can control what you see inside of the uterus and make sure that everything is clean inside out. Normally, not all the physicians like to put the hand inside a lady onto the uterus to basically swab very gently the uterus because they think that is basically some kind of taste. I don't like to put my hand onto my elbow inside of you to try to clean you out. In my practice, I did it myself. I think that I do a better service when I make sure that you don't have a huge amounts of tissue inside of you because that is stop the bleeding faster and probably avoid any kind of infection later on, like exactly what happened in this case. The problem is that the lady returned back after 3 days with a huge bleeding. The smell in that area was obvious that was a gross infection inside of her, and then the platelets came completely down. The platelets completely down. She started to bleed herself out because the problem is the infection started to spread inside of her to a point that in less than 7 hours she died. I died in ICU over there. I was lucky in the sense that I received the patient, but I was leaving out. Basically was a septic shock after that. In that particular moment that I am basically leaving out the hospital, the patient reached. I basically transferred the patient to my next doctor in line. When I returned the next day to the gynecology, I encountered a huge mess. They gave her something for the pain, waiting for the lab results. When the lab results reached back, they discovered the problem. They immediately called the gynecologist like at 3 a.m. The gynecologist tried to do a D&C, dilation and curettage over there. And in that precise moment, she entered in basically in cardiac arrest. She never survived. 32 years of age. The lady have a body stamina, very small frame, but with this inflammation process going inside of her, she became like a water balloon, very gross. I still remember the day that after she passed away, my friend, my other doctor over there, was completely knocked out by the situation. I basically told him, "Go. I will continue over here with the big boss." I helped the big boss to basically unwrap the body because something that most of the nurses don't know when a person die in the hospital is the nurse who prepared that cadaver. There's a particular kit that we have in the hospital, and like a beautiful mummy, you will wrap that body and prepare for transportation to the morgue. Well, I need to wrap that body and split the legs for that boss of mine to do a particular culture for to see and trying to catch the bacteria who did that mess. But that's the kinds of situation that always we need to pay attention with that. Oh my God. Oh my God. Carlina, you are lucky. You are lucky. Because what I said is basically what I try to avoid. And in your case, you need to be blessed because, believe it or not, I will only tell you, you are lucky like hell because those cases when they start to progress very quickly, meaning that it's matters of hours and that happens. After that day, every time that I see a pregnant lady with this situation, I always in guard to make sure that every piece of placenta is out. If I need to put my hand inside of that uterus, I will do it because it's a catastrophe to have a new mother with a newborn over there and a newborn without mother already. That is the most catastrophic part of it here. I still remember the scene because the entire family was outside of the ICU. We didn't inform of the death of the to the family member until we did the culture over there. But it's always a catastrophe when you had this kinds of situation, especially she was so young, 32 years of age, and then a teacher. yeah, it was a sad morning for almost everybody over there. But again, that is the reason that I always like to ask for this one, meaning make sure that everybody pay attention to this one because this is 404 is something that is catastrophic. Yeah, I promise you, you will see a case like this one because believe it or not, they are often showing up in the hospital, especially in gynecology. Okay, moving on to the next one. As you see over here, the famous disseminated intravascular coagulation. This is what happened. All of that will trigger, and this is very interesting. All the platelets are the person start to bleed for every bleed to the ears, to the eyes, to the nose, to the mouth, to the anus, very gross over there. That in this particular situation, the platelets are consumed very quick in these particular scenarios because the bacteria in that particular attack is doing okay, I would have to repeat myself. In these particular scenarios, what happened is that the platelets have been used for that body too fast. At the same time, because the platelets are used too fast in that body, the person start to bleed himself out. Every area that are a hole, you will see blood coming out. Eyes, ears, nose, mouth, anus, vagina. For every corner, you will see that person bleeding himself out because the infection, because the septic shock, and because the use of this particular situation. That is the reason that even here, fresh frozen plasma is one of the indication for this particular situation, but at the same time, you need to have an antibiotic therapy to contrarrest the invasion of this bacteria inside of this body. Again, I will not ask you this one. Moving on to the next one. You see the removal, exactly what I mentioned to you. Fresh frozen plasma, a lot of blood. Some people use heparin, but guess what? I don't like to use heparin because normally heparin for me is to break down the clots. But in a person that is already bleeding himself out, I don't like that. Meaning that even that your book like to say it over there, but look what he said at the end, controversial. It's still for me a little bit controversial too. Again, I will not ask you this one, just the first one. That is the supposed, but remember the problem with this particular disease, yeah, I will go back, is that you are forming clots inside of the big vessels. And some particular physician like to use heparin to target those particular clots that are forming in the vascular system. The problem is I can break that clot in one vessel, but the blood is still coming out from every corner of the body, meaning that that's why it's controversial over here. I prefer to give fresh frozen plasma, antibiotics, and all the things that I can reanimate that person because the blood pressure will go completely down in a scenario like this. It's like the blood cannot be held inside so your blood cell and start to escape from every corner of your body. You need to keep the pressure going because if the blood stops, the game is over. And that's the reason that why I'm agree with this particular part, but not with this one. Okay? But everybody has their own book, depending what is the exposition to these particular cases, and probably you change the mind, or everybody changes their mind when they see a case like this and the way that they treat it. Now, reaching the end of the chapter, this is a multiple choice too. This one is 204. Remember that any hepatic disease will affect the coagulation factor production. If you have a person that is, for example, alcoholic for long, long, long time, this need to pop out in your minds immediately. Oh, this guy is alcoholic for how long? 20 years. Immediately, oh, the liver. This guy is not producing coagulation factor. meaning that he can bleed out himself immediately. He's not producing coagulation factor because the liver is damaged. Oh, this guy probably have also problem with the formations of vitamin D. Oh, I have a problem with the absorption of calcium too. Oh, meaning that that is the kinds of thing that need to reach to your mind immediately because that is how we operate in the clinical setting. As soon you give me the input of that information, I start to make connection with every particular situation that can arise from that person. For example, not only a liver affection can affect the production of the coagulation factor, depending how is, or I will say, how extensive is the damage in the liver. Because if the liver already has cirrhosis, that over there is tricky. Remember, cirrhosis is a scar tissue. Many people think that the scar tissue is a sentence of death. Not necessarily. The liver is the only organ that can regenerate in your body. And when you have a person with cirrhosis, if you tell to that person you need to follow the treatment to the dot, you can have a longer life even in those conditions because the scar tissue cirrhosis don't progress unless that you continue with the injury. And for that reason, one of the things that they need to follow is no consumption of alcohol at all. Diet. Any medication that is metabolized in the liver need to split in a half. If you follow these particular conditions to the dot and the instructions of the doctor, a person with cirrhosis can have a longer life. But the reality is they are humans, and the humans they can follow the instruction for the next 3 weeks, but the summer reach on town, I forget, let's go with the first beer and let's go with the first whatever that they start to drink, and then the affection and the problem continue increasing. I have situation the person that has been with cirrhosis for a long time because did follow the instruction to the dot. But not everybody is the same. That is the reality. Meaning that careful with this patient because the only thing that they can save them in the long run is obviously the donations of a liver. But for the people that don't know this, and I'm probably in my audience, as soon you said to that company or to the hospital that will do the transplant that you are an alcoholic, you will be the last in that list because they will not give a liver to a person that is not a person that probably will not take advantage of that organ and will make a misuse of that organ. Meaning you need to pay attention to that. Okay. That doesn't mean that people with a lot of money will always have the best organ, but still careful with them. Moving on. Hepatic disease, the treatment over there. Basically, we repeat this one several times. I will not go with this. And the final one in the chapter is question. I will leave this one to you. And believe it or not, chapter 14 is gone. Yeah, we stop the recording.